I would say that if you are a middle-aged woman and you're not thinking about your gut microbiome, you're missing out on an opportunity to support your health. The gut microbiome communicates with every single organ system in the body. Do you know that the health of our gut impacts when we go into menopause? The ovaries, which set the pacemaker of aging for women, we're born with a finite amount of eggs, unlike men that replenish sperm every 72 hours. And so if you understand that the health of your gut impacts when you go into menopause, impacts the health of your fertility, that blew my mind. I was like, this is not a conversation that we're having with our providers. And so whether it's the influence of our personal care products, our nutrition, our environment, our stress levels, or the quality of the food that we eat, all impact that microbiome. It's either giving it good inputs or it's detrimental inputs. When I think about the impact of our childhood, good or bad, has a large impact in the imprinting of our nervous system, which impacts our gut microbiome because acute stress is good. Like right now, I'm sure if you measure my cortisol levels or yours, they're up a little bit because we're attuned, we're engaged, we're having a conversation, we're excited. But chronic stress is incredibly detrimental to our health. And we're now fully understanding the impact on not just the gut microbiome and leaky gut and all these other factors that I'm sure many people have heard of, but also might impact when we go into menopause. Chronic unrelenting stress, adverse childhood events, that can impact when we go into menopause. Why aren't we having that conversation? Because even though I trained at a leading medical institution here in the United States, we never had that conversation about the impact of chronic stress. We talked about it like big T trauma, little T trauma was kind of a benign, innocuous. We didn't talk about it. And so I very humbly sat back that this book is just a vehicle to be able to share information. But if you're leaving the gut microbiome out of the longevity and aging conversation, you're missing out because you can't just replace hormones. And they're important. Let me be very clear. I'm very pro hormone replacement therapy, or at least having a conversation around that. If you're just replacing hormones and not thinking about the gut, you're not going to have the same longevity markers. You're not going to have the same experience as someone who's being more conscientious about that. And why would we be conscientious about an organ that we have never really been taught much about? I would say number one, estradiol, which is our predominant form of estrogen our bodies make prior to menopause, is a potent immune modulatory hormone. So that means that as our ovaries are aging, so does our immune system. And estrogen, the loss of estrogen is really catastrophic for the immune system. That means that we have a thymus gland when we're born, and usually after puberty, they call it thymus involution, which is a terrible way of describing it. It kind of shrinks up, doesn't really do much. But it's really important for our immune system. And so our immune system without estrogen starts to become a little more reactive. It tends to be a little bit more prone to developing autoimmune conditions. We know 80% of women are the ones that make up the bulk of those that are diagnosed with autoimmune conditions. About 20% are men. And we see there's over 100 now. When I finished my medical training, there were probably like 20 or 30, but we're just finding more and more and more of these autoimmune conditions. So more likely to see more autoimmune diseases. Big ones I see are Hashimoto's, celiac, lupus, rheumatoid arthritis, chronic Lyme, long haul COVID. All are autoimmune, unfortunately. And the other thing is we become less responsive to vaccines. So when I go to my local pharmacy to pick up my estrogen patch or whatever I'm picking up, they always offer me a constellation of, this is CVS. For anyone in the United States, if you go to CVS, they will offer you Pneumovax, which is the pneumonia vaccine. They'll offer the shingles vaccine. They'll offer a flu vaccine every single time I go. And what's interesting is our immune systems, because they're dampened in menopause, we have less reliability. If we get a vaccine, we're not going to be able to mount as much of an immune response. And so I remind people, it's both good and bad. There are people who genuinely need these vaccines. I'm not anti-vaccine. I want to make sure that's very clear. But we're not as responsive to vaccines. And that is a byproduct of this loss of estrogen and this immune system kind of modulation. So that's number one. Number two, with a loss of estradiol, we get shifts in diversity. So there are keystone bacteria, which make up the bulk of our microbiome. And obviously, this is all very bio-individual. So if you've had multiple rounds of antibiotics, if you're eating a standard American diet, if you have chronic unrelenting stress, that is going to influence your microbiome, as opposed to someone who lives a little more, a diet where they're eating more nutrient dense foods. They manage their stress as best they can. And maybe they've had a couple courses of antibiotics, but it's not a chronic relenting course of antibiotics. We know that if we have less Keystone bacteria, we're more likely to have inflammatory bacteria. This is the dysbiotic organisms. And I remind people that whether it's antibiotics or chronic stress or the standard American diet, we're much more likely to breach the lining of that small intestine. So the term leaky gut, I think most people are familiarized with. Estrogen is responsible for helping keep those little tight junctions together. So with less estrogen, we're more likely to have leaky gut. On the other side of that small intestine is the immune system. If the immune system gets provoked, more likely to mount an immune response if we leak food particles into our bloodstream. So for those of you that are bloated after meals and it's new, you're reacting differently to food, especially dairy. Dairy seems to be one of these really reactive foods for middle-aged women. And then another thing that I think is really interesting, if we're talking about the big things, we have less short-chain fatty acids as we get older. And so people think it's no big deal. Fiber is not important. I hear that a lot. Short-chain fatty acids are potent signaling molecules in the body. Things like butyrate can cross the blood-brain barrier. Really important. So when we eat fibrous foods, we goes through our digestive system, ends up in the large intestine, where the colonocytes use it for food and they ferment, and then they can produce these short chain fatty acids. So butyrate is very important. It can cross the blood-brain barrier, and the blood-brain barrier is designed to be impermeable, but we want butyrate to be able to cross the blood-brain barrier for a variety of reasons. We're also less likely to create, in conjunction with another keystone bacteria, endogenous GLP-1. So GLP-1 drugs are very popular right now for good reason. I think they're helping a lot of people. I think we're seeing also some people that are microdosing and getting improvement in inflammation, autoimmune disease, et cetera. But our body makes GLP-1 on its own. And so if we have an alteration in the production of short chain fatty acids, like what happens in the setting of less hormones, we're not making as much. So you will be less satiated. We know that short chain fatty acids are involved in conjunction with certain keystone bacteria to produce mucus to protect the lining of the small intestine. The small intestine, if I didn't already mention it, is really important for absorption of nutrients. So not only are you impacted with this mucus production, protection, more likely to have leaky gut, as I remind most women that are heading into perimenopause and menopause, we become less stress resilient. So stress becomes a bigger impact on the gut. It's not just I'm engaged with Zora and I'm excited and I know my cortisol's up a little bit. That's acute, like happy stress. I'm talking about the chronic stress, the people that don't have any boundaries, people that are in toxic relationships or have a really miserable job. Someone moves, someone gets divorced, big things that impact our stress levels over time. You have a toxic team member, whatever it is going on in your personal life, we all have stress that comes about, but chronic unrelenting stress not only will break down the small intestinal lining, in the setting of being well stress resilient, it'll break down our muscle. So we talk about how precious muscle is. We'll break that down as well. So there's a lot of different things that start to happen, but those are some of the, I would say, the big picture items that for people, when they tell me fiber is not important, I will say fiber is very bio-individual. Fiber is indeed important. And if a woman tells me she can't tolerate fiber, the first thing I say is we have work to do on your gut, because over time you can heal the gut to be able to tolerate more fiber. But to suggest that fiber is not important at all, you're not following the research, and certainly not what I'm seeing clinically with patients. So I think those things all impact us. But what these show up as is bloating, digestive distress, someone saying to me, I feel like food sits in my stomach. I just don't digest it as well. And that could be as simple as you need more digestive fire. You need hydrochloric acid or digestive enzymes or supplements like TUDCA that help you emulsify and break down fats. Also important for mitochondria. But I think for a lot of women, we get very accustomed to whatever is our normal is normal. Mm-hmm. And I'm here to tell you that these symptoms can be signs of this kind of dysregulation in the gut, that many women, they go to a gastroenterologist, they see their internist. There's nothing serious going on. But that gastroenterologist, that internist, more than likely was never taught some of these changes that are occurring that are driving those symptoms. And how do we kind of circumvent them? Because I don't think anyone listening wants to experience constipation, bloating, digestive issues, feeling like there's a rock sitting in your stomach. I had a patient recently say to me, I'm so worried at gastroparesis, which is the severe manifestation, usually of diabetes, where you get decreased motility in the gut, and it's oftentimes not reversible. And then when I explain, hey, listen, if you understand that progesterone is a smooth muscle relaxant, and estradiol is important for nitric oxide production in our body, which is another super important signaling molecule that helps dilate things, and especially important for endothelium, which is the lining of our blood vessels, explains a lot about why people feel like they're just not moving food as efficiently through their digestive system, it's a byproduct of the loss of hormones. And so not enough people are made aware of these things. And I think knowledge is power. Like that is the big takeaway. There's so much information in the menopause gut about what we can do. And the microbiome is incredibly malleable. So if your microbiome's a mess right now, trust me, I was there in 2019. I am 100% better now, just like countless patients I've worked with. There's so much that we can do. This is not meant to be scary, but this might be the first time you're hearing this information.